This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today, we're looking at a fascinating new study from the Journal of Neurology, Neurosurgery, and Psychiatry, published in 2026. The paper is titled, Comparison of Neuropsychological Side Effects Between Contemporary Radiofrequency Ablative Neurosurgery for Psychiatric Disorders and Conventional Neurosurgical Procedures, Systematic Review and Meta-Analysis.
This is a critical piece of literature, Alara. As we see in our clinics, psychiatric disorders are increasingly contributing to global disability. It's a massive burden on the healthcare system, and more importantly, on the patients and their families.
Absolutely. And the authors point out a frustrating reality. Despite the significant advances we've made in conservative management, like pharmacotherapy and cognitive behavioral therapy, the prevalence of treatment-resistant cases remains high. We are reaching a ceiling with conservative measures for a large cohort of patients.
That's where neurosurgery for psychiatric disorders, or NPD, comes into the conversation. However, as the paper notes, NPD remains underused. Alara, in your research, what does the study suggest are the primary drivers for this underutilization?
The paper identifies two main hurdles. First, there are very strict regulations governing these procedures, which varies by region but is generally much more rigorous than for other surgical interventions. Second, and perhaps most significantly, there are deep-seated historical concerns, specifically concerns related to NPSE, neuropsychological side effects.
Right. The ghosts of the past still haunt the field. When people hear psychiatric surgery, they often think of the mid-20th century procedures that lacked the precision we have today. This study seeks to modernize that perspective by focusing on contemporary radiofrequency ablative neurosurgery.
Exactly. The researchers performed a systematic review and meta-analysis to compare the NPSE profile of these modern ablative psychiatric procedures against conventional neurosurgical procedures. By conventional, they mean the types of surgeries we perform every day for other indications.
It's a clever comparison. We often accept a certain level of neuropsychological risk in a tumor resection or an epilepsy surgery because the pathology demands it. By benchmarking NPD against these accepted procedures, the authors are asking, is the fear of NPSE in psychiatric surgery disproportionate to the actual data?
Exactly. They really dive deep into the contemporary radiofrequency ablative techniques. We aren't talking about the broad, blunt interventions of the past. We're talking about precise, image-guided radiofrequency lesions targeting specific circuits.
And for the residents listening, it's important to remember why radiofrequency ablation is the focus here. It's a mainstay in contemporary NPD, allowing for discrete thermocoagulation of target tissues. But the question remains, does this focal ablation lead to the cognitive or personality changes that the historical stigma suggests?
The meta-analysis sought to quantify that. They looked at various domains of neuropsychological side effects. The authors emphasize that while conservative management is the first line, the treatment-resistant label shouldn't be a dead end. If the NPSE profile of contemporary radiofrequency ablation is comparable to conventional neurosurgery, it challenges the current regulatory and social barriers.
Let's talk about that treatment-resistant cohort. When we say the prevalence remains high, we're talking about patients who have failed multiple rounds of medication and therapy. For these individuals, the disability mentioned in the abstract isn't just a clinical term, it's a total loss of quality of life.
And that's the ethical crux the paper touches on. If we are underusing a tool like NPD due to historical concerns rather than contemporary data, we might be doing a disservice to those with treatment-resistant disorders.
The focus on contemporary is key here. The paper is specifically looking at modern outcomes. In the neurosurgical community, we need to be evidence-based. If a systematic review and meta-analysis shows that the neuropsychological side effects are manageable or comparable to other standard of care surgeries, it changes the conversation with our psychiatry colleagues.
It also changes the conversation with the regulators. The study mentions that strict regulations are a barrier to access. If the data from this meta-analysis shows that contemporary radiofrequency ablative neurosurgery is safe from a neuropsychological standpoint, it provides a strong argument for revisiting those restrictive policies.
Precisely. We need to move beyond the historical stigma. To our residents and students, pay close attention to the NPSE data in this study. Understanding the cognitive safety profile is just as important as understanding the surgical approach itself.
It really is about balancing the global disability caused by the disorder against the potential NPSE of the intervention. This paper provides the high-level evidence needed to make those assessments more accurately.
Well, that's all the time we have for today's deep dive. This study in the Journal of Neurology, Neurosurgery, and Psychiatry is a must-read for anyone involved in functional neurosurgery or the treatment of refractory psychiatric conditions.
Thank you for joining us. It's an exciting time for the field as we use contemporary data to overcome historical barriers.
I'm Dr. Aris.
And I'm Dr. Alara. We'll see you next time on the Neurosurgery Hub podcast.